Kevin Yates here from Yates Performance Training, and today I wanted to share this video and talk about how to fix upper cross syndrome because this is one of the questions I got a while back from somebody who was watching one of my videos on my YouTube channel and asked about it. They had a previous shoulder injury and they never really got the mobility and the strength, and still had pain on that side. And noticed that they had an upper cross syndrome, which is where the shoulder is kind of internally rotated. So it's kind of like this. The back sometimes is a little bit hunched over and stooped forward. So it's kind of that type of thing that we see. It can happen on both sides, or it can happen on one side versus the other. So today I'm just going to share some things that are not commonly talked about to help fix upper cross syndrome. So if you're dealing with that, if you've had any kind of a shoulder injury, if you have any kind of like chronic shoulder pain, and if you've noticed that it's affecting things like your posture, your mobility, your strength, and like I said, just, you might have chronic nagging pain or dull ache or something like that, that never really gets any better. It's kind of always there, or maybe it comes and it goes, but it never really goes away. So this video might really help you out. So in talking about upper cross syndrome, one of the most common things that we tend to do whenever, we're trying to strengthen something, or we're trying to improve our mobility or our flexibility, or decrease pain, we tend to think about stretches and exercises, right? These are the things, the most common questions I get. What are the best exercises I can do to strengthen my shoulder? What are the best stretches that I can do to improve my shoulder flexibility or my mobility? What are the best exercises to get rid of shoulder pain? These are the most common questions that I get when it comes to issues like this. And as much as I do support and believe in exercises, flexibility, and all of these things, and posture as well, I think a lot of times what happens is we try these things and we don't really get results. Now, if you do these things and you get results and it fixes the problem, great. It can happen that way. But for a lot of pain and injury sufferers, especially shoulder issues and upper cross syndrome, which is more of like a posture and stability issue, you can tend to find that these things don't work. So you might have tried exercises and stretches, rehabilitation, physical rehabilitation. You might have tried adjustments. You might have tried pain medications, cortisone shots, maybe had a surgery, any types of these things, or other things. And if you find that you've done these and they haven't really worked, or maybe sometimes they work a little bit, like when you do the stretch or you do the exercise, things feel good, you move a little bit better, or you might feel a little more stronger or more like you have more stability for that time in that moment. But then, within a day or two, it kind of goes away and the pain comes back, or the flexibility's not there again, right? And so that's what I'm talking about, that you have to keep doing these things over and over and over for, weeks and months and sometimes even years on end, just to maintain the little bit of results that you get from it. So what I'm going to suggest here is something that might work a little bit better. In a lot of cases, it really does. And the reason why, if you don't respond to, or you haven't responded to these conventional stretches, exercises, and pain reduction methods and things like that, this probably is the issue for you. And that is that we have to look higher up. Instead of looking at just muscles and joints and trying to fix muscles and joints all the time, what we have to realize is we have to look at what it is that controls muscles and joints and movement and strength and pain, and that is the brain and nervous system. So even though exercising and stretching do work on the nervous system and brain, they kind of work at it from the opposite end. It's like a longer, slower end. And which is why, if these things haven't worked for you, that's probably why they don't work. It's just, it takes a lot longer and it's not as effective as if we work from the other end, right? We work directly with the areas of the brain and the nervous system that are responsible for things like posture, things like pain reduction, things like muscle tone, movement, right? So one of the areas that I want to talk about here, because it completely relates to posture in upper cross syndrome in particular, is the brain, and particularly an area that we call the PMRF. And this area of the brain, it's fascinating because it controls about 90% of posture and stability in the body. So if you think about that, this area of the brain controls about 90% of posture and stability. So if we're trying to improve posture and stability by doing exercises and stretches, that's really only accounting for about 10% of that, right? Exercising and stretching, it's great, but it only really accounts for about 10% of our posture and stability. So it's like we're leaving 90% of the results that we could be getting on the table and not addressing them. So it's a critical thing. So this kind of describes you. If you're nodding your head yes, keep tuning in here. Let's talk a little bit about how to assess this area of the brain, the PMRF. And that way, when you go through, I'm going to name a few assessments here. When you go through these, if you find that, these assessments, you're responding as if this might be an issue, it's going to let you know that this area of the brain needs some activation in order to help with your posture, reduce pain, improve mobility. That's what this area of the brain does, the PMRF. It helps to inhibit pain. It helps to improve posture and muscle tone. And so that's important stuff when we're dealing with an issue like upper cross syndrome. Okay, so one of the assessments that we go through, it's just a basic walking assessment. Like when I look at posture with people, clients, I used to do it where I would have them hold their posture and just stand there and I'd, look at them from all angles. But what I started to think about and realize was that for a posture assessment, pretty much anybody can hold correct posture. We can all stand up straight, pull our shoulders back, get our heads level and eyes level, and for a short period of time, most of us can do that. But when we're walking, it's more of a real life kind of look, a big picture look into an activity that we all do. We all do it naturally without thinking about it. And so it's easier to get a better look at what our posture is like when we're doing something like walking, because we do it all of the time. And what I've found is that you learn a lot more about your posture when you see how it looks in your everyday activities or in something you do every day, rather than when you're just consciously trying to hold it for, a few minutes or so. So that's one of the things that I look at. And what, you want to look at really is, are there significant postural issues? Like we talked about upper cross syndrome on one side versus the other. Obviously it's an issue, but does that show itself? Does it get worse when you walk? Do you have other postural issues that this might be affecting as well? So maybe this isn't like the only thing that's going on. There might be other issues that are going on as well. So it's just a good idea to get an overall idea of what your posture looks like when you're moving. Now again, you have upper cross syndrome, you do, it's a postural issue in and of itself. We can just go from there and take it into a muscle palpation test. So let's say that you had the upper cross syndrome on the left side, so your shoulders internally rotated, you're kind of, it's pulled, your shoulders pulled forward a little bit, protracted compared to the other side. So we can do some muscle palpation testing just to see, because again, one of the things that the PMRF controls is muscle tone. So if you find that you have some weakness, if you have poor muscle tone in like the upper trapezius area, so right here between the shoulder and the neck, where bodybuilders got those big old grapefruit looking things up there, that muscle, compare it, look at it and look at your other one and do it, obviously shirt off, and look at, the actual muscles with your clothes off, and look at that side versus the other. Is it less developed, or does it look less toned? When you feel it, you push into it a little bit and push into the other one. Does it have similar muscle tone, or does it feel different on that side versus the other? You could do things, the same thing with like your lats, you could do it with your pecs. So those are just some ideas to palpate muscles and and look for like muscle tone, and visually look for the differences side to side with that. And obviously strength is another issue, that you can look at on one side versus the other. But I'll say this, that, if you're dealing with issues where, the side that you've got, the upper cross syndrome, if it's weaker than the other side, well, anytime that we have an issue with posture, so posture is just like, if we've got this thing happening, this upper cross syndrome, it pulls us out of what would be a more stable and a more healthy posture, right? It pulls us out of what would be a good alignment. And when we get pulled out of that alignment, not only do we have quote unquote poor posture, but it's what the poor posture does, and it decreases our ability to move, and it decreases strength, because now we don't have as much stability. We're not as stable in that posture, so we don't move as well, and we're not as strong. And then, if we try to do things that require more movement than we have from that position, so if I've got a rounded shoulder here, this upper cross syndrome, here's what happens with my shoulder mobility. That is not me just stopping. I'm really trying to move. I can't move any higher than this. So if this is what I've got, and I have to reach above for something in a cupboard, and my cupboard's higher than this, I'm going to have to really strain my shoulder, and my shoulder's not going to like it to get into that cupboard. So, we might be able to make compensations, but it comes at a cost, and it can really irritate the shoulder. If it keeps going on, the shoulder can get more immobile and weaker over time, and then we start to irritate other areas like the lower back, because we can't reach, and so we start to compensate through the back. So, a whole slew of things can happen as a result. But the key point being that if we don't fix the posture and alignment issue first, and 90% of that comes from the PMRF in the brain, then, we're just asking for more problems down the road, and strength really is not likely to come back, because we're not as strong when we're not aligned well and we're not as stable. So hopefully that makes sense. And hopefully that sheds some light on, if you've got upper cross syndrome, those are a couple quick assessments you can do to test it out and to see, if this looks like it's an issue for you. And if it is, then great. That it's the PMRF that needs some work and some activation, and you can just go right into working on that. So hopefully that helps, and hopefully you got a lot from this, and hopefully it sheds some light into, if you're dealing with shoulder pain, injuries, loss of strength, mobility, and particularly an upper cross syndrome, either on both sides or one, and stretching and corrective exercises and rehab, exercises or adjustments and things like that might not be helping solve the problem. This is probably the area or the reason why, in the area that you need to be looking in. So I hope that this helps. If you have any other questions, type them in below, and I'll talk to you next time.